everyone, guys, I want to share my joy with you. I have finally opened my own clinic, something I have dreamed about for a very long time. And hooray, I did it finally. Well, I just want to share not what kind of clinic it is, but why I opened it. Listen guys, I've been in this profession for over 20 years. And I know this system from the inside. The system is excellent, it's really good, especially here in Australia. But there are significant underlying issues with this current system. It primarily focuses on treating specific diseases, but it unfortunately doesn't prioritize overall long-term health. So what happens is that we treat chronic illnesses, but we can't change a person's whole life or take it to a completely different level. And that's the thing, we just don't have the time or resources for that. You see what I mean? And everything is fine when it's all about disease, it's all evidence-based medicine, everything gets treated, everything is good, everything is according to the guidelines, it all looks great. But what about people who feel tired, who feel like something is wrong and come to see the doctor? They get their tests done and the doctor tells them, your tests are normal, everything is fine. But the person feels that something is wrong, that something isn't normal. And for 20 years, I've been observing these people. They come in and I've seen how their lives can be changed. I've seen what the problem is, but it's not in the tests. It's much deeper than that. So I decided to start with a weight loss clinic, and of course you're all going to ask why. It's not the most severe or the most terrible symptom. Obesity or being overweight. But this is where the biggest gap in medicine is, and I just can't stay silent about it. It makes me want to cry and scream. That is what's happening right now. The way we target weight loss is basically through lifestyle. Medicine should. In other words, essentially, we have to change all of a person's habits and routines, but as doctors, we just don't have the time for that. So what ends up happening? We get some kind of segmented care, basically. As doctors, we prescribe some medications for weight loss, the person leaves, we refer them to a nutritionist or to someone else. But all of this is fragmented and the person ends up with nothing and without their health. That's it. And so in order to really help this person, you need to guide them more closely through weight loss, show them the way and set them on the right path. And it's not that difficult. That's the point. But it requires a more tight relationship between doctor and patient. And so, for those who are listening, I keep hearing from friends, Olivia, well, you'll probably be that doctor who will prescribe these medications, these injections, Mounjaro, Wegovy, Ozempic. Guys, no, that's not what I'm here for. On the contrary, I actually want to put a stop to all of this. It's sacrilege. No, I'm not against these medications. They're good medications for reducing appetite. And in principle, I'm not against prescribing them. But I believe it should be a comprehensive approach, not just a single medication. Boom, and that's it. The thing is, people end up feeling lost. They lose weight without understanding why or what's happening to them. And then they can't keep the weight off. They lose it and then gain it all back. And it's even scarier when these people have their stomachs cut out. Yes, bariatric surgery. And people are still overweight. And people are still fat. Then people just come in. They come in tears. They don't know what to do. And I see this issue. I see the problem. I know how to help these people. But I can't. I'm sitting at this appointment. I have 6 minutes for a consultation. And the system isn't set up to handle this. That's it. You see? And weight loss, it sounds funny, but actually if you dig a little deeper, it's not about weight loss. Everyone is focused on weight loss. But in reality, this clinic would actually be about feeding people, bringing them back to their normal, healthy physiology. And then, in other words, there shouldn't be any restrictions, no need to push anyone, no competitions, no challenges, nothing like that. We're simply bringing a person back to their and to the initial settings they were born with so that they feel like new again. And this, I'm not telling fairy tales or anything, it's actually very simple to do. But you just need to address not only the weight, not just weighing someone on a scale, it's a more comprehensive approach. That's what I do. I create a psychological map of the person. What their triggers are, what their personality type is, I'll talk more about this method in future videos. And by working closely with me, through tests and our work together, a person receives instructions on how to use themselves. That's when they can finally enjoy their life to the fullest. They'll forget about all these restrictions. They'll finally be able to eat normally. And the weight will go away on its own. How is that possible? It's not the goal, it's just going to be a consequence of a normal lifestyle. Do you see what I mean? In other words, it's actually that simple to do. There are barriers. From birth, these settings have been knocked out of us. That's the thing. We already have everything we need. All the chips, everything is already in our body. It's just that these settings were knocked out of us from early childhood. Not right from breastfeeding, but immediately after. That's the thing. And can you imagine, how am I supposed to do that? And that's why I'm opening a clinic, can you imagine? But at the same time, I understand that at first, the people who will come to me will be those who have lost hope. For them, I'll be like Lass, operating on those who have already had their stomachs removed, those who have already been on these injections running back and forth and who have already ruined their health. I understand this. I see these patients. They come in just sobbing, they don't know what to do, and they think they're going to die overweight. Well, I hope that thanks to education, people who haven't done anything yet will start with a proper, comprehensive approach and not with some of the crazy things that are happening now. That's what it's all about. And speaking of that, in the end, we are leading my teams, we guide people, and thanks to our work, we turn their whole lives in a completely different direction. Can you imagine how valuable that is? And when I talk about longevity, for example, I'm not saying that a person will just live longer. All my patients tell me that. I don't want to live a long life. That's not the point. The point is that we spend most of our time involved in something else. In a kind of agony, can you imagine? We're not living. We're just existing. Yes, I see most patients after the age of 30 or 40. Because their settings have been messed up and they don't know how to manage their own bodies, they live in agony, they're constantly tired, sleep deprived, they don't know what's happened to them, depression, anxiety, and of course weight gain. All of this is the result of the same thing. So it's not really about longevity as a field, but about giving a person life, letting them feel that life, and live it with better quality. Well, in general, I've shared a little bit, and I'll continue to share my methods in the future. I just want to mark this beautiful moment when I finally did it, opened the clinic, and this will be like my diary. Good luck to everyone, and let's get started.